Hi, my name is Farah Jalloul. I am the Director of Professional Development with the Michigan Pharmacists Association and State Pharmacy Emergency Preparedness Coordinator. Before COVID hit, many of us did not really think that there is a correlation between pharmacy and public health. However, throughout COVID and the COVID pandemic, pharmacy truly has been a key in overcoming the adverse effects of the pandemic. So today I would like to just briefly go over the role of pharmacy in emergency preparedness and response with you. So why pharmacy? Pharmacists are highly visible members of the healthcare community, and involvement in emergency preparedness generally begins on a local level. Pharmacies are ideally located to play an important part in any local response. On average, 90% of Americans live within 5 miles of a pharmacy. So accessibility is key, especially during an emergency response. Pharmacy professionals are adequately equipped to assist the public during response efforts, whether through our education or our accessibility. We are truly there to help the public. As pharmacists' role in providing vaccines continue to expand, we can also help prepare for pandemic situations, as we've seen with COVID. Pharmacists play a role in education and preventative measures. Again, with screening, testing, counseling, and just being that healthcare professional that folks can seek during an emergency response. Now, the pharmacy's role as a profession can vary based on what the actual emergency is. So there are some pharmaceutical caches that are out there that could be deployed if there's a certain emergency or like a biologic attack within the state. Accessible healthcare point of contact. I've repeatedly covered this, and again, it is because we are truly one of the most accessible healthcare professionals within healthcare. The maintenance of traditional community healthcare support. During COVID, pharmacies were ideally the first point of contact that the public had before reaching out to their PCP or anything of that sort. Mass vaccination and testing, again, that was also depicted throughout the COVID pandemic, and mass dispensing. So whether it's partnering up with your local health department or hospital and healthcare system, or even doing a closed point of dispensing for either therapeutics or testing materials like at-home testing sites. So the role in COVID-19 pandemic, my role in general, I am grateful to represent and advocate for pharmacy professionals at the Capitol in Lansing and throughout the state of Michigan. Looking at the COVID-19 pandemic in general, again, we would not be in the position, I can confidently say that, we would not be in the position that we are in today if it was not for pharmacists, pharmacy technicians, and student pharmacists. Whether it was educating the public about the vaccines and helping overcome vaccine hesitancy or dispensing oral antivirals and other COVID therapeutics, just to name a few, pharmacists were the key in overcoming the stress of the pandemic, and we saved lives. Pharmacists saved lives. Each and every day, we got up and we did what pharmacists do best, and that is to provide the most accessible and quality healthcare. So I was privileged enough to have a seat at the table from the beginning of the pandemic in Michigan at the State Emergency Operations Center, where the governor, her staff, our state chief medical executive officer, and other public health officers met and discussed statewide COVID-19 planning and initiatives. Initially, when COVID first hit, the state was struggling in setting up testing sites, and we discussed the accessibility portion. We didn't want our state residents to go and wait in an emergency room or wait in a PCP's office. So we talked about what can we do and what is really accessible for folks. This is where 90% of Americans live within 5 miles of a pharmacy comes in. I was able to facilitate discussions between the state and pharmacies and chain pharmacies throughout Michigan and pilot a drive-through testing site, which was really, really successful. And that model was utilized throughout the state. So this is actually within the State Emergency Operations Center. And this is actually our governor, and she's addressing Michiganders throughout the state and during one of her public addresses. But this is where we would meet, and there's a station for each entity within Michigan, and this is where a lot of our brainstorming ideas came together, and we did a lot of our updates as well. So another role that I took part in was to ensure that the proper information and treatment guidelines were provided to pharmacists throughout Michigan. So initially, we had a lot of our medications were still not FDA approved. And so there were some of them that came in, test vials, and some of them came with limited information. And so my role was to provide our pharmacists with enough information to ensure the proper storage, administration, reporting throughout the administration process. And with everything changing so constantly throughout practice and throughout the COVID pandemic, I was the resource for Michigan pharmacists to ensure that they had the most accurate resources, whether it was for COVID vaccines, COVID treatments, even, PPE guidelines and isolation guidelines. All of that did come from the Michigan Pharmacists Association. Another thing that I helped with facilitate was COVID vaccine clinics. So this right here, we had one of our largest FEMA vaccination sites in the state of Michigan. And basically what it was one of our stadiums within Detroit. It's called Ford Field, which is a stadium that is usually there's concerts there, and they play football, and so we took that and we had military staff personnel, and we created a vaccine clinic where folks can schedule their appointments online and come through and get vaccinated. So my role was to make sure that the people administering the vaccines or even withdrawing the doses and everything had the appropriate information to do so. So this was a very, very cool and unique thing that I got to do with our military personnel in our state that is definitely something very, very unique. Other vaccination clinics that I work on is legislative vaccine clinics. And, it's very important to make sure that our legislators see us in action. It is very, very important because then they understand what pharmacy is. It is more than just a white coat. We are very accessible. We can come to you. We can do a lot of different things, which is very cool, right? We got to administer vaccines, and this is, we did flu and COVID vaccine clinics. We've done multiple clinics at our state capitol, and it gives us time to sit and speak with our legislators and to show them what we really can do and what we continue to do for our patients, our community, and the public in general. Which leads me to my next point, advocacy. Advocacy is one of the most important aspects of pharmacy. It doesn't matter what you do, where you practice, whether it's community, health system, public health, wherever you go. We need to advocate for our profession. We have a voice, and it's a very powerful voice, believe it or not. And COVID gave us an additional platform that validated what we already knew, which is, again, pharmacists save lives. And we must continue on that path. We must continue to advocate. You, as future pharmacists, you have a choice. You can sit idly by and complain, or you can become part of the solution. You are the next generation of pharmacists that can dictate the future of practice, not just for you, but for many pharmacists to come. Now, I'm not sharing with you, issues or anything with our practice, but I really would like to encourage you to be involved, to be innovative in your practice. Let your voices be heard. We need to change people's perspective of what a pharmacist does. We are no longer the person sitting behind the counter counting by fives. With our knowledge and our accessibility, we are more than that. And you must challenge those pre-existing notions of what the pharmacy profession is. Your voice is louder than you can imagine, and we need your help to advocate for the future of pharmacy. If you're unsure where to start, this is where networking and mentorship comes in. Find a mentor, reach out to your faculty at your school, reach out to me, your state association, attend a national or your state association's annual convention, and network with pharmacy leaders. Consider completing an API elective at your state association. Network and learn from those who came before you. It's so vital for you to do that. Finding a mentor that believes in you is the crucial difference in terms of your career pathways, specifically around the advancement of the profession, where you will not know everything about it, but that's why you surround yourself with good quality people and mentors and you learn from them. And do not forget, there is strength in numbers. Hence, get together, rally, and meet with your legislators and talk to them about what, or your elected officials, and talk to them about what pharmacists do and how we can increase access and help those within the vulnerable areas within your state or your city or what have you. Thank you for taking the time to listening to me, and I hope you keep an open mind regarding your pharmacy career and where you will end up, because you may never know what could happen. And I truly thank you for listening, and I hope you have a great one. Thanks.